assuming that the at-large members count in terms of whether we have a majority or not. But I will start. Lisa Knoll has retired, I think, from the commission, not officially yet, so I did invite her. Lisa Hotley was not able to attend. Sue Orton, I see, is here, but she's not a voting member. Wayne is here. And Liz is here. So we don't have a quorum, which means we can't vote, but we do.
We have no picture. We lost our connection.
You know, we know that Nancy has good equipment.
We're back connected. Hopefully it doesn't do that again.
Nancy, can you hear us?
Yes, we can hear you. Thank you.
Okay, so I'll just go through the members' terms, and we know that if there is no new application to serve, that we can continue on in our seats even after our expiration date. So Liz's term expired in July of 2024. Lillian's term expired a few days ago on September the 2nd. Wayne's good through December 19th of this year. Lisa Hotley is good through March of 2027. Lisa Knoll was good through September 19th, 2025, but since she is no longer an active participant in an agency, we are recommending that the person that succeeds her at Area Agency on Aging Ahead, Christine Husted, replace her. And she has filled out an application with the county to succeed Lisa in her seat. And I got a call from Dr. Page's assistant, and they're working on that approval process. So Lisa Knoll's seat will be filled, we hope, unless there are any objections here, which I don't suspect there would be, since that component, having a voice from the Area Agency on Aging, is so crucial to what we do. Cookie's expiration for the seat is July 18th, 2026, so she's good. Mike Nickel is good through March 14th of 2026. Carol's seat is good through August 15th, 2026. My seat is good through November 2nd, 2026. We've had another resignation. Wilma has resigned due to personal issues. And so I had recommended that Nancy Morrow Howell fill her seat, since Wilma's seat is for a representative for a service agency or university. It seemed very appropriate that someone of Nancy's stature at Washington University be able to be on our commission, and Nancy has graciously accepted my offer to join the commission, and she has also filled out her application And Dr. Page is aware of it and supportive of it. So unless there are any objections, I'm hoping that Nancy can soon be participating in our commission. And then you're still listed as a vacant seat on this document too.
Call from, this is her, his name is Bruce Allen or Allen Bruce, I think it's out here.
He is the assistant to Dr. Page.
Yes, I got that because I got an email months ago saying, oh, congratulations, you know, your appointment and yada, yada. And you need to talk to your council president or something about, going before the council. So I did.
You've already had your public hearing.
No.
No, so that's the piece that is missing.
Well, no, apparently now that's changed too.
Okay,
I'm not real sure. I feel like I'm in limbo at this moment.
well, we've all had our official confirmation hearings
Right,
in front of the
except
county council.
I had mine scheduled. And then they canceled it. And so then I had another one scheduled. And they canceled it too. And so then I said, okay, why don't you call me and tell me when it will work for you? Because I don't know what to say. Like,
When was it canceled most recently?
oh, months ago?
Was it after our committee of the whole?
Yes, I think.
Interesting.
No, it was months ago. And
All right.
they never called me and I'm like, well, okay. So then I get this call from him the other day, Tuesday. And he said, did you ever, were you ever sworn in? And I'm like, well, no, here's what happened. And then he's like, well, I don't know why they would have canceled it. And I said, I'm just sitting here like, I don't know, but I'm not sure what's going on either. And so then he said, well, now you just need to go be sworn in.
And this was
Just
Alan
like that.
Bruce that you were talking to.
Yes.
So how do we get,
Well,
the
I got
agenda.
the message for them.
Okay.
And they're supposed to be calling me back. However, I will call them back today because I gave them through yesterday.
well, I recommend that you call your council rep, Gretchen Baker,
Yeah,
to, because she's very supportive of you.
he is.
And she's been very supportive of this commission.
Well, and it was the assistant to,
Dr. Page.
no, that's not who canceled me. No, it was, it was the assistant to, Shalonda Webb.
Okay, well, so the new chair is Rita Days, I believe.
It is.
So I think contact Rita Days. Because Shalonda Webb's no longer the chair of the
Right.
council.
That's why I couldn't remember if it was hers or
Yeah,
days, but
it changed fairly recently.
both times, called and canceled.
Okay. Because we are, lucky to have, the appointments, applications in for every single seat available, which is rare for us. And we have support from the
Right.
council and these county executives. So I don't know what the holdup is. It shouldn't be a holdup. Maybe it's a matter of showing up to a council meeting and saying, can you swear me in? But that's kind of, and as we know in the past, there have been challenges getting even our required confirmation hearings in place. And we acted as if the members, these unofficial members were members, they fully participated, they just didn't vote.
Well, he said, well, when I talked to Ellen, I said something about voting, and he said, it's unclear whether there'd be a problem. I'm like, if I'm not a commissioner, there's a problem with the vote. And
Yeah.
he said, well, I think you'll just get it, we'll get it started. I'm like, okay.
Okay, so the good news is we've done our jobs finding excellent people to serve on the commission who are willing to serve. Now this is a little hiccup, but we'll get through it. Next agenda item is that Christine and I have been asked by Nancy Moore Howell to participate in the St. Louis Area Biobehavioral Participation Registry. It's and Nancy can tell us more about it, but they've requested from the commission ideas for what data would be helpful, as well as suggestions of what might serve as an incentive for older adults to join the registry. And Nancy, if you can hear us, can you tell us more about this registry?
Yeah, Dan, can you hear me?
Yes, we can.
Great. Well, Dan is graciously coming to a meeting after this one at WashU to hear more about it when we have community people coming to advise us. As you know, WashU does a lot of research, and we're all soliciting independently for people to participate and asking our random research questions. So this is an attempt to be more systematic and organized with the St. Louis region. We're thinking city and county to solicit older adults who are willing to be on the registry, and then we would reach out to them to see if they're interested in particular studies. That's not that innovative, but what's more innovative is we want to keep a baseline database on all the folks who agree to participate, where we would have information and collect it over time to keep it current about socio-demographics, about needs, anything that we can figure out with the community as a core. We can't do it all because studies will be doing more in-depth stuff, but some sort of basic amount of information. Then we could produce reports at the request of our community partners. So Dan, you'll be learning more about it. We're just beginning. And of course, this is contingent on grant funding that we're seeking in a very uncertain environment. But that's what we know for now. We're in developing the stage. We just like to make this helpful to all people in the community. Is that enough for now, Dan?
It is. I think what I'd like to do, though, is solicit maybe ideas from the commissioners on how maybe older adults could be incentivized to participate in
Correct.
the process.
That'd be fabulous.
So what does any, I'm just throwing this out you, and it's really, I'm asking to brainstorm really, is a meal enough of an incentive?
So how is the mechanism when people are invited? There'll be a mailing, a phone call. How will people be invited to potentially be involved in this?
Well, that's where we're getting advice from our community partners, agencies, Dan representing the commission. All of the above. How can we spread the word through individual organizations, through social media, through community announcements? It would be so great if we could actually get a representative, bunch of people on the registry, because that doesn't often happen. So we'd like to be outreach in multiple ways to try to get as many people in as representative of older adults in our communities. So we're open for suggestions, but we've got a lot of ideas about doing it in a wide variety of ways.
So when you say a representative, do you mean somebody that is acting more as a leader of the people?
Yeah, no, Dan, I meant from it's like a research study, representative of the population. So we don't have all high-income people from Clayton, that we have people from all over the region that represents all levels of socioeconomic status, all levels of geography. So representative in terms of a sample representing the whole population better than we usually do.
Yeah. Well, we have, since this commission does represent all council districts in the county, we do have some connections, but we're not, our commission doesn't really have a great website or social media presence or anything like that. We do have face-to-face. There's certain commissioners that are quite active in their communities. I think Cookie is one.
She's the first person
who really knows everybody in the Spanish Lake area. And she's great at just dispersing information to her constituents, really. So I would suggest that we get Cookie involved in this, in that district. Susan Orton's hand is up.
Yeah, I had a thought too for Nancy, is that many of us have different organizations that we support or belong to. I know I have several, and that we would be willing to disperse this to, that group as far as our network is concerned.
Outstanding. Yes, Dan, I mean, I think it's quite a great idea that we reach out to all of the people here that represents the various districts and get ideas about what organizations, where to put flyers, where to, how to do it by region to try to ensure representation across all the districts. But I really appreciate that idea very much.
If we had any hard copies of the ask, we could definitely distribute it to people that we touch, which is, Liz and I were talking before the meeting started, and we're both kind of amazed at how many other task forces, subcommittees, working groups we've been asked to participate in because of our participation here. So we could bring, a brochure to a lot of places.
Yeah, I kind of just second what Dan said. I think, so first off, I think we can go to, for instance, Lisa Clancy has a newsletter that she sends out. So we can go to each one of our representatives and ask them. And Wagner has a newsletter she sends out. Sam Page has a newsletter. So that there's one thing. So then I'm on the coalition for I can't remember which coalition. Well, one is elder abuse, and the other one is
the broadband.
Yeah, broadband. And the broadband one is particularly probably to get the word out. So
Aging Ahead has the whole network of seniors.
Yeah.
Centers.
and senior centers.
Well, Dan, I'll say this is all in the beginning stages. These are fabulous ideas. We don't have anything hard to share. We'll have digital and hard and every way possible when we get that far. The other thing we're getting advice on is, how to get people interested. We don't want them to feel like there's nothing in it for them. So of course we'll be doing standard gift cards, this, and information and resources that. But we also want to make sure we're finding ways to make people feel good about joining the registry. But Dan, I will rely on you to come back to get some of these specific ideas on paper that are district by district.
Okay.
Nance, this is Mike. How you doing?
Hi, Mike. I don't have a clear vision of the room, but now I see you. Now I see you.
In the back there.
Hi.
That guy with the beard. Anyway, is there thoughts about infrastructure on this project? In other words, are you asking for enough grant funding to fund, say, at least a part-time position as a coordinator to help with things like outreach, as well as things like maintaining the registry to keep it up to date?
Yeah, we are. That's what the grant will be about, is person power to outreach to people, explain it, get them involved, keep things updated. That's why these things don't work, is because there isn't the infrastructure to keep it alive and updated.
Right.
Yeah, thanks, Mike.
Too, given the population we're dealing with,
Yeah.
a lot of things happen where they need to drop off. So
Yeah, correct.
it's important to keep it updated.
All right, well, more to come on that exercise, and we love to be the recipient of these studies after they're. We're happy to participate, but we love to have the data as well, because it helps us make persuasive arguments when we're asked to advise the council. So, okay, the next item is update on the Senior Services Design Group, which is an initiative to rethink how regional senior service organizations might better collaborate in the new funding environment. And, what we mean by new funding environment is the lack of funding environment. And so I was invited on this working group earlier this year. And we have been working, meeting very frequently. Nancy's also on the working group. I don't know, we've probably met a half a dozen times so far, in addition to having open sessions that I've sent invitations to the commission whenever there's an open session. When there's an open house at a public library, I've sent out invitations so that everybody could see this process and then give feedback on the process. And the feedback has been really wonderful. And so what we're trying to do, just to state it a little differently, is there are lots of disparate organizations that serve seniors in the region. There have been organizations in the past that tried to be this clearinghouse of organizations. The Breakthrough Coalition comes to mind. It really hasn't been that for a while. And there have been others, and there are other, not-for-profit organizations that have certain focuses, like, housing services have organizations, different trade organizations for people who serve specific niches, but there isn't a regional organization that kind of grasps all of us and allows us to speak to each other. And what was really potent for me was during the pandemic, when we became a very impactful group, because it wasn't just a bunch of commissioners sitting around a table talking. It was people from the senior fund in the city. It was people from AARP. It was people from the academics side who would participate in our meetings, because everybody realized that we were in crisis during the pandemic. And the issue really started to be about social engagement. And because the public library representatives started to participate in our meetings, we were able to figure out ways to be impactful and to actually do something that is still ongoing. And so I think we've all come to understand that when you have disparate voices coming in beyond our commission, talking to us, that we learn about where the pressure points are, and that we can actually do something about it. And so when you have the area agencies on aging, you have the senior fund in the city, you have the potential for a senior fund in the county, you have other organizations like Oasis. We could go on and on and on and on about the organizations that touch everything that is within our purview: housing, transportation, accessibility, health and wellness. We could go on and on, engagement. We've had this organization, some sort of network that is a clearinghouse is really needed. And so we've been working on a variety of kind of focus areas and trying to narrow it down. Right now, we're down to about 8 kind of focus areas, and we need to get more narrow than that. We had more than a dozen. And I'm going to just read off what those focus areas are right now. And we're taking comments on them. One is Partnership Assessment and Assistance Program. And it's a committee of providers assess the needs and gaps across the network with input from different organizations. This group makes recommendations on organizations that might be a good fit for partnership and help them get access to legal and coaching support.
Would you give an example of what that?
Partnerships could come in a wide range of formats, from MOUs to full mergers or acquisitions or other formats. The Partnership Recommendation Committee would consist of people familiar with areas like housing, health, food, etc. Organizations could suggest potential partnerships for evaluation by the committee. The committee's work would be confidential and would review information about finances, needs across the region, and other data. The committee may look at opportunities for new funding, scaling up programs or approaches, or new ideas. Some funding may be available to support organizations through merger or collaboration processes. I think that the focus really is that because every not-for-profit is stressed for funding, how can we kind of get the, good morning, get those organizations that may be floundering right now to collaborate with other like organizations or possibly even merge with those other organizations to make them stronger. It's, so it's a way to assess the viability and the sustainability of organizations to try to help them be more viable and sustainable.
It's what Jamie's done in the city. I'm sure did when she was there, and I'm sure it's being continued, but when she had grant applications, she'd take them and call them up together and go, wait a minute, you guys are all, you all have really good, strong proposals, but you can be stronger if you work together and resubmit as a group. So you're not duplicating efforts and you're searching dollars.
Exactly. I think we agree, we all understand that people who serve this community can sometimes be in this competitive situation with other
Because they're all competing for
organizations.
dollars.
So
Yes.
that's counterproductive.
Yeah.
So how can we, instead of compete, how can we work together better? And so another opportunity for that is the coordinated regional funders leadership. And so funders across the region work together, and this is the proposal, work together to lead on direction, policy alignment, and priorities for older adult services in the region. They do this by meeting regularly to identify and communicate gaps and risks, prioritize funding, and streamline their operations. This includes issuing RFPs that bring together multiple funding sources and support for collaborative applications. So, because revenue is going to be really challenging in the upcoming years, we need to find other sources of funding. And so there are foundations out there that do fund senior services, but there are a whole lot of organizations that aren't in the senior services realm that could be. If you touch, hunger issues, you're touching older adult issues. If you touch housing issues and accessibility issues, you're touching older adult issues. So how can we find those foundations that are already serving the communities through hunger outreach programs and things like that to understand that there needs to be a greater focus on older adults in programs that they're already doing, and shifting funding towards organizations that are doing it with more of an older adult focus, or even just supporting the organizations that already exist that do it, expand their outreach. Because as Nancy has taught us in the reframing conversation, universality helps us all. When you can support something that doesn't just serve the older adult community, but also touches the older adult community, you're still helping that community. So that is another kind of subgroup that I think got a lot of support, because there was a lot of support for trying to find creative ways to raise money for these organizations. Another one was centralized operations center and consultants. Some of these got less support than others. Nancy, I don't know if this one got a whole lot of support. A centralized set of staff and tools are used to manage the operations across multiple organizations and programs. This team helps set up and run new and expanded revenue generation for organizations, supporting the logistics of fee-for-service, fundraising, and more. Consultants support organizations to streamline their operations. And so there are kind of consultants out there that do help some of the smaller not-for-profits. I think Catch a Fire is one of them. And Nancy, I don't know if that was part of this subgroup or not, but there are
Yeah, I think-
professional. What?
Yeah, I think Catch a Fire was part of those ideas.
Yeah, so there are professional organizations that volunteer to help, help smaller not-for-profits. So, if you're a small not-for-profit, STL Village is one of them. And their executive director would have meetings with somebody at Catch a Fire, who is somebody who spent their career in the business community, and that person could have expertise in marketing or business development or fundraising, or they could have expertise in kind of, accounting and finance, things that a small not-for-profit can't necessarily, hire people to do because they don't have the budget for it. So there are, free services out there. And so the thought was, how do you centralize these services so that all of these organizations can avail themselves of it somehow? This one was a challenging one to implement. I'm going to go on to the next because there are a bunch of them. Infrastructure for coordinating skilled volunteers and in-kind contributions. So with other partners outside the Aging Services Network, build a process and a system to tap into the volunteerism of highly skilled individuals and companies across the region. Needed skills might include home repair, business skills, legal counsel, and more. There's somewhat overlap in what I just mentioned, but this is more specific about volunteerism. And the challenges that we saw with this one are that a lot of organizations really cultivate their volunteer base, and they're very protective of that volunteer base. They don't want to share that list with others in the same way they don't want to share their funding with others. So it's a tension between how do you collaborate and still compete? How do you collaborate, still do what you're doing and not suffer from the collaboration? And so this one was kind of set aside because it was complicated, very complicated. And also there's a need. How do you vet your volunteers? So there are certain processes, processes and procedures that would be helpful to all, because you don't want to just invite, STL Village as an example has a kind of a wellness check sort of aspect to it, where you'll visit people in their home, friendly visit, or helping people by volunteering to drive people to doctor's appointments or things like that. But those people need to be vetted. You don't want somebody with a simple record,
Yes,
volunteering for those services.
vetted in the beginning.
Yeah.
Continuing process of evaluation.
Right.
Because all the life situations change.
But specific organizations like United Way and others already do a good job of vetting. So this was a tough one to kind of for us to wrap our hands around. Another one was awareness campaign for aging in the region. And this one got a yes, please, as soon as possible, kind of green light from everybody in the working group, primarily because of what's happening in the county right now. Because there is this effort, this education effort to help create a senior fund for the county. And because there is a clock ticking on this effort, and we'll get to that, the awareness campaign for that effort is extremely important. Why is a senior fund something that we support for the county? And to answer that question, what are the benefits to our constituents throughout the county? It's not just particular districts, it's all districts. And a year ago, we know because we received the presentation from Maryland Mission Fund, that we saw the results of the survey that was done throughout the county, and we saw that there was majority support in all counties for this. But how do we get the word out to more people who are voting to support this tax levy?
Dan, one thing is that one of the things that all of these have in common is funding. And the whole thing that we've been saying all along is that in order to effectively coordinate all of these different groups and all these different needs and assess them, you have to have a paid position that is, and that was Jamie, and that's what we are trying to get. through this new tax.
Right.
So basically, it all boils down in one way to the need for this funding.
We need the
Oh,
funding,
yeah.
but we need we need people to tell the stories. So storytelling is a huge component of this. And so there are people in the community we probably know that can tell us how impactful a specific service was to their life. And I attended an event for affordable housing and home repair earlier this year at the Federal Reserve Bank. And one of the panelists was a woman who received home repair services from, I believe it was Rebuilding Together STL. And she talked about how it changed her life just to be able to, get grab bars and ramps and simple fixes to her home that allowed her to just get out. But so those stories, those personal stories are really important. So, how do we collect them and how do we get them to the people that are working on this campaign? And if you know of any people like that, tell Jamie about it. But, but the other venues are podcasts, video series, media placements, events, that share a clear, cohesive message to reinforce the importance of the sector to people across the region, primarily targeted at policymakers, but also relevant to the public. So, is it presentations to the county council? Is it presentations? Is it visits to our council reps? Is it introductions? But we've got to figure out ways to get the word out ways that are potent.
I think one group that's overlooked in when these things are being targeted and with the, senior fund and San Luis County and all that, I think the group that maybe is going to be overlooked is the older adult population. You've got to convince them because a lot of them are sitting out there doing well, like we're all sitting in this room and we're doing good, right? So we don't see the relevance of it, and I don't want my taxes to go up. And I don't want to have to pay more money because I don't want my financial status to be in jeopardy always, by those other expenses. So you have to bring it to them and show them that there are people just like them that are not as fortunate.
So there are other,
Going through bad
so
things.
who are the lobbying groups that have a voice already? The silver-haired legislature, am I getting the term right?
Maybe.
So how do we get to them? Can we invite representative of silver-haired legislature to one of our meetings?
It's not a bad plan.
Who has a connection to them? You do. Okay.
Sure do.
Christine, can you?
Yeah, I mean, we could invite, I know we're St. Louis County, but if you wanted representatives from St. Louis City as well, yeah, our 4 counties, which are St. Louis, St. Charles, Jefferson, and Franklin, but then there's a statewide coalition too. So we're part of that. Silver-haired legislatures.
So if we could have, because they're listened to.
Yeah,
So,
they're a powerful group.
and they were very supportive of the tax freeze. And this is in some ways counter to a tax freeze, but it is not a huge amount of money per household to achieve something that is very impactful to them. So how do we convince them that this is important?
I think just having a conversation. I think many of them already see the value of the levy, so it's just getting it to be one of their top 5 priorities.
And that's a good thing, because
Yes.
I think there's a lot of people that I come in contact with that are maybe not as willing, they're just not willing to risk their financial security. It's like, it's a scary thing. It's like when you don't necessarily have the money, the ability to go out and generate more income for yourself, then you're protective of what you have. I mean, if you have a whole lot, I guess it's, fine, but I think otherwise you get a little protective of that. And it's like, well, I keep my expenses go up, then my security is going to go down.
But, and Jamie has shown us some early data on what the cost impact would be on average for a
Right.
county household, it was something like $19 a year or
And
something.
that's what, those are, those are.
You know, that's not a lot of money, to have a lot of services.
And I think that we need to get these silverhead legislators in front of are people, the county executive page and members of the county council. So maybe that's something that we should recommend, is that as a commission, we convene a meeting with the county council and the county executive with silver-haired legislators to talk about how important it is to take care of that community. That sounds to me like we have asked virtually nothing of our council people. And I think if we, as a commission, can start to demand at least to have them meet with these people.
Well, I think that's a
Yeah.
good step in the right direction, because without 4 council members' support, we can't get this on the ballot.
And all you have is Gretchen Banger.
She's the only one right now that is fully in support.
Well, I think maybe what we need to do then is have this commission organize a meeting between the county council, county executive, and the silver-haired legislators to talk about how critical it is that the services that are provided for that population be reinforced, be understood, be coordinated, be supervised, for lack of a better word.
And it may be challenging to get all of them together in one room for a hearing. It is easier to get one-on-one meetings. I think many of us have already had one-on-one meetings with many reps. And if we were to invite one, silver-haired representative to that meeting who represents an organization that any elected official knows is an important, person to have on your side, I think maybe you start with some lunches, and if you can get with some key players, people that are already maybe tilting that way but need to be convinced. The challenge is the county is fighting for needed dollars, and because, we're getting stressed. Not only are we getting, lower federal funding for things, we're also getting people, 80,000 people, I think, applied for the senior tax freeze in the county. And that doesn't generate revenue, goes the other way. And we have a county executive who'd like to see upgrades to the infrastructure of the county facilities, which is very expensive. And there are other, pressures that need money, for money. And so it's hard to get the support for this, even within people that would historically be supportive of it. We don't have a definitive yes from Shalonda Webb, from Rita Days, from Lisa Clancy right now. And even though the polling, the surveys in districts like Mike Archer's District 6 was very high, because his demographic is changing. A much higher percentage of people over 60. And he understands that. But how do we convince him to be a yes vote on this? All right. So the next, we got a little off topic, but the next kind of group that we had a hard time getting our hands around was called Next Generation I&A, Resource, Database, and Provider Connections. And I'll summarize, building on the current I&A system, this digital resource is accessible to providers, older adults, and families. On the provider side, it includes integration that allows sharing client data to ensure needs are met. On the client side, it allows self-navigation for finding resources and understanding how and when they are accessible to serve older adults' needs. We know that we've heard from our reps that a resource guide is needed and desired in communities. People don't know where to get them. There used to be hard copies of these resource guides. Nobody has them anymore. Nobody's producing them. They're on even electronic. I mean, I told Nancy yesterday that I was looking on websites for this resource guide, and it directed me to the St. Louis Times resource guide. Well, it doesn't exist.
Because that was the last one that was out there.
So that is part of this, but our discussion yesterday was, how do we roll this into the awareness category rather than its own category? Because on the data sharing side, there are lots of challenges that we don't know that we can deal with right now. But on the, helping users understand and navigate is something that we think is really important. And so we've been screaming for a resource guide. We talked about it in our last COW. And we did make asks. We said, please support the senior services fund for the county. So, all right, the next one, I don't want to dominate the whole meeting, but older adult multidisciplinary strike team. And Liz and I are very supportive of this. And Liz can speak to it from the elder abuse side. But it's not just the elder abuse side. As a participant, so develop a set of trained and ready to deploy experts who can rapidly reach and support older adults in the region, whether in a crisis or every day. The organizations involved set up a funding structure and MOUs in advance so they are ready to go at first need. So what generated this discussion was the tornado. So it was a great opportunity for people who are going in to help repair homes to see what other needs are. I mean, when you walk in the front door of someone's home, because you're invited in because they need a new air conditioner, you can see that an individual isn't necessarily eating, or they aren't able to clean their home, or there are other needs that aren't met. And who is the person invited in the home who can then address more global issues of need? And so what I'm seeing from the home repair network side is that they are usually the first people that are invited in. My roof is leaking. My air conditioning doesn't work. I need a ramp. I need grab bars in my shower. You're invited into the home and you can see, it's pretty evident. So what we need to think through is how to get not just that initial invitation, but how to expand that to somebody who can help assess other needs. And so, does somebody have to sign a waiver or, you have my permission to come into my home, and it's not just you, Mr. Contractor, but it's also you, Mr. Social Worker, or whatever, who can then help assess other needs.
Well, this is kind of one of the things that I know we've had trouble with on the financial abuse side of things is there are these hotlines. And what we need is a cold line. We need some sort of a neutral mechanism to coordinate that isn't a hotline. Hotlines are they appear very benign, but I know on the financial abuse side of things, you're really not, you don't want to
Be in the system.
exactly be in the system, but also you don't want to be too judgmental. But yet you might see that, because what we found in the financial abuse end of things is what you want to do, as with child abuse, is you don't want to say you're abusing that child when you spank them. What you want to say is you are financially taking advantage of that older person by asking them to mow their lawn for $200 when really it was $20. And the person needs the lawn mowed, and so they don't know where else to go. So how do you, instead of saying you're a bad person, you want to say, hey, you're taking advantage of this person, and it would be better for you and for them for you to not do that. And I hear all the time small stories. Oh, well, it doesn't matter. They've added a little bit more money to the credit card when they've gone and done the grocery shopping for grandma. Oh, well, yes, they bought themselves a new car, even though grandma doesn't, really use the car, can't drive anymore, and it's to drive them. So just, it's in many ways, it's more of a, getting back to what we said before, an awareness thing. These older individuals have worked hard to have the financial resources they have. So we, as members of the community, have to make sure that those resources are being taken care of.
We have to figure out a way to do it that isn't perceived as being invasive.
Yes.
So we have, Liz and I met with Melissa Price Smith earlier, was it this year now or last year? I can't remember now. It's been so long. Prosecuting attorney in the county about this multidisciplinary team approach for elder abuse. And she was extremely supportive of it because she's had personal experience in this area. And so, that's part of it, the legal mechanisms for, if something is flagged as being elder abuse, it's not just a police officer or a prosecuting attorney going in. It's actually, somebody with a social work background. It's somebody who can help say, you might not realize, but what you're doing right now is abusive. You're a family member and you're writing checks out of your grandma's checkbook, or you're doing whatever. This is a no-no. Let's intervene before it becomes.
And the people who are in a position to see these are your bank tellers, are your pharmacists. They are the people, are the postman. I mean, I got the postman was who alerted me once when my aunt was leaving her door wide open when she really shouldn't have been. And he just quietly saw me come by and then came over and said, that this is a situation you need to be aware of. So it's empowering all of these individuals, or giving them the voice to talk about these things, but where do they go? I mean, who do they talk to? The postman had to wait until they saw me. He didn't know who to go to.
So this was a topic, this was an area of discussion that got mixed support yesterday in our group meeting. And I think it got mixed support because there are a lot of complexities to implementation. And so how do you do that promptly? We were trying to focus on things we could do right away. And this one's going to take a lot more kind of finesse and careful thought about, who's trained to intervene, how is it done, what entities can do it. But it was seen as important enough. We had green for, yes, let's do this. This got some green. The next one down was, yes, we think this is important, but maybe we don't do it immediately. That was a blue. So it got a mixture of greens and blues on this one. And so whether it's I think the strike team was maybe the part that got people a little afraid. Another one was geographic hubs for critical services, small hub spaces in accessible retail locations like malls or shopping areas provide access to a variety of services needed by older adults. When older adults arrive, they are able to plug into resources that are important for their well-being. Christine, I mean, you're already doing that.
Yeah.
Service centers and so, this one, how do you, I don't remember if it got full support or I think this was another one where globally it was hard to think about implementation, but the area agencies on aging through senior centers or through collaborations with libraries or community centers are already doing this, aren't they?
Yes, we do need to do a better job of awareness about the services that people can access. I think a lot of times people think of a senior center and just think of the meal, but there are other services available through that. The other piece is, I don't think we're in every community we need to be in. For example, North, we have programming at Lewis and Clark Library in Ferguson, and that's it. And North County is very broad. So there are areas that we're not in that we want to be in. So that's the other.
One thing with that is that we can get, because Cookie is going to be somebody who can really sit there and talk to Shalonda Webb and say, this is something that we need. And I think this is getting kind of going back to my earlier point, is this commission has finally, I think, got the legs where we can start making some demands of our council people. And that's one area that we can, that Cookie can go to Shalonda Webb and say, listen, there are so many people in your district, and we have 2 facilities, hubs, and we need 4. So do we work with the library? Do we work with, I mean, it can be also like the police, local police or
Fire department.
Fire department, yeah.
Or retail establishments. When we first met, when we invited Cookie on the commission, we met at a restaurant in a small strip center in Spanish Lake. And I mean, it was not fully occupied. There were vacant spaces in that strip center. And there were some very popular venues like the restaurant itself. So are there ways to collaborate with some of the building owners?
They're also up in North St. Louis, there are several community farms. And those are hubs. I mean, they provide, food and, they have volunteers, so that's another area that might be.
I think the library's offering, social workers in their facilities, and, I mean, I don't have updated information, but they were very popular. Those people were very, very busy because the libraries are very non-threatening.
Yeah. So when area agencies on aging started to take over the whole grant pad program from the public library, what is the venue where that occurs?
Well, so that's all of that is virtual.
But I thought it was I thought you became you qualified for the grant pad because you qualified for meals.
So, yeah, so for our program, I think with the library, it was just anyone who wanted the device. And then because of the restrictions with our funding, it was narrowed down to people who didn't have another way to access the internet or were at risk for being homebound. They didn't have to be homebound yet, but if they had limited transportation, it was harder for them to get out. They needed in-home assistance, that kind of thing. Those are the people that we focused on just because of our funding restrictions.
So if there was no physical place where you would disperse,
It's all virtual.
it's all virtual.
Yeah, it's through the device. And then the meals.
How, is there any update on the grant pads, on what's going on with that?
Sure, yeah. So we're part of a WashU, and I'm not sure which, I think they're in public health now. But there's a group at WashU that received an NIH grant. It's a SEAL study, but essentially what we're looking at for Aging Ahead's perspective, it's a 4-year research study. It includes 400 clients that are already homebound, so home delivered clients, and then 250 that are at risk for being homebound, plus the initial core group, which is actually outside of the study, but we're still providing services to them. So for the research component, we're looking at outcomes. Really, we want to make sure that the services we're providing through the virtual center are as effective as what people would receive in person. So again, 4 years, we're about 1.5 years in. But just looking at isolation outcomes, nutrition risk, access to community resources, those kinds of things.
Was your NIH grant impacted by the changes in expenses?
Thankfully, not yet.
Really?
So.
Do you have any preliminary findings on that? Does it look like it's
We do.
effective?
I can share them. I don't have them.
Yes, that'd be great if you
I'm happy to share them.
because I think that information also could be very helpful in our conversations with the county council people on the funding.
Well, we asked for additional funding from the county and we were rejected to expand that study. And they said, well, go to WashU, ask them. Anyway, okay, so the next topic is this, an update on the senior tax levy initiative. There is an executive committee meeting tomorrow. I've been invited to the executive committee. I'll be participating in it, but I've been touching base. I've been away a lot this summer, so I missed the meetings. There's an upcoming steering committee meeting, but what I'm hearing now is that that our paid consultant who's advising us on kind of the PR aspect and when to be on the ballot and all that stuff is telling us that the most advantageous time to be on the ballot would be November 2026. Because it's a midterm election, it appears that the people more apt to vote yes for funding this would be out at that election. The challenges are we need 4 council members to support this to get on the ballot. We don't have it yet. And the challenge in getting their approval is that they also have a ballot initiative that also is revenue related that they want to put on the ballot. And my opinion is it would be ideal if they would put theirs on the ballot in August or April rather than November. The challenge is it costs money to the county to put something on the ballot unless there's a statewide or federal election coinciding with that vote. So when they put something on the ballot last April, this Proposition B, which was to give the council the power to hire and fire, managers, they spent $500,000 to get that on the ballot, and then it failed. So there's a lot of sour grapes over that whole process, and they brought it up in our COW meeting. They don't want to do that again. So it would cost the county nothing for us to be on the ballot in November. The question is, will it cost them something to be on the ballot earlier? Because what I'm hearing is that some council members want their initiative passed before they consider our initiative. So if we're on the ballot at the same time, how do we get their support?
So what is their revenue request?
Oh,
What is it?
I don't remember. I think it has to do with infrastructure, but I could be wrong. Is it to upgrade I don't know. But I know that they have an initiative that's going to be tax related. And their feeling is that you put too many things on the ballot that are tax related and the voter just goes, no, 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 no. We don't want that to happen to either one of these initiatives. We want to be supportive of theirs. We want ours on the ballot in November because that's beneficial to us. We don't want to push it down the line because it's already, we're going to see the impacts to not-for-profits and to other organizations that need grant money whose sources are drying up. So it's really critical. So any ideas? So, well, that's going to be the big topic. I think one of the big topics is how to get support from the individual council members. I think people who represent districts here on this commission, we represent all 7, are going to be asked to maybe go out to lunch with a representative of the Senior Tax Levy Initiative and your county council rep to kind of reiterate the importance of that, and maybe getting the senior haired legislator to join in that lunch would be helpful. You just need to figure out ways to be persuasive.
Nancy, I want to go back to this registry. Is the point of this registry is to try to have to collectively get a large group of older adults all pooled together so that you can ask them various or get them involved in various efforts? Is that part of that?
The only outcome of the involvement would be to participate in research studies and to contribute data. It wouldn't be to organize them on a specific effort like this one.
No, I guess it's not saying, but the point is that if you're, for instance, this Grand Pad, that particular program is going to give us data on that cohort of older adults that we can then translate into better services, better policy. Is that kind of Is that
Yeah.
sort of what we're heading for?
I would say yes.
So, next item is the Missouri Master Plan on Aging. I don't have any updates on that. I don't know if you've participated in anything, Christine.
Yeah, we had our Summit on Aging earlier this week, in Columbia, and Division of Senior and Disability Services, did one of their town halls on the Master Plan on Aging. They have several recommendations. All of these recommendations do have very specific action items. Some of those action items have funding behind it, some of them don't, so they're really gonna rely on the community if those move forward. It is out for public comment until the 14th, I believe. So if you go to their website, and I can share that as well and look through it, you're welcome to provide feedback on that. Again, just want to highlight one of the questions that came up that I thought was worth reminding people of is the Master Plan on Aging is really intended to be inclusive of all ages, to plan for healthy aging for all of us, not just a specific older adult population, versus the state plan on aging, which is prescriptive through the Older Americans Act for a 4-year period. So this Master Plan on Aging is sort of a bonus for Missourians right now. So if you can encourage younger adults to also look at that, that would be valuable feedback.
Thank you. Next agenda item, Universal Design Building Consensus on an Educational Approach. Yes?
I was able to attend
Oh, good.
one of the meetings, the first one, which was in Leaning, and I was positively impressed by the presentation. It was Mindy, you stand?
Yeah.
Chief Bureau of Senior Programs, and she did a very good job, and then whatever. And it just, it's a 10-year plan, and one of the statements that was made, which I was baffled with, is that 31% of adults living in the state of Missouri, living in population living with a disability. 31%. You have to probably define disability and all that, but it's extremely high. But they were talking about some of the same things that we have just listed in this, in different sections: daily life and employment, family caregivers. Communication in all of this was critical. How we're doing it. Housing and aging in place, finance and funding, legal issues, improving administration and policies, housing and aging in place. So these all, you read them on and whatever each categories that they addressed. And it sounded very familiar, similar to some of the things that we just finished talking about. So there's
Definitely.
a 10-year plan. And it's going to be 10 years, and there's going to be a lot of changes going on. So anyway, I felt positive about it, and talked to some individuals afterwards and everything like that. So it's a favorable impression. It's a lot of work and everything like that. But it sounded like it was a stable plan, and there's all kinds of details, and 10 years is a long time, a lot of changes. But anyway, I was very favorably impressed.
Wayne, what were the things that really stuck out to you that that you thought would be really effective that's part of that plan?
Well, I guess communication is one of them. And just one of the things that we've talked about here in terms of these activities that we're doing with are some of them a little heavy-handed or strong issues that people would be rebel to. Just generally telling me what to do with my house or suggesting, in such a way that I can't refuse and those kinds of things.
Mandates.
I'm a little hesitant and scared at that. But, maybe that's what it takes.
Well, one of the things, because I'm up in Canada and that during the summer, they're much further along and have been for a long time as far as this whole idea that everything has to be available, usable, as far as depending upon your ability to do things. So and it's, I don't know, it's kind of the chicken versus the egg type rule. Because once you have every house accessible by a wheelchair, all of a sudden the house that isn't accessible by a wheelchair stands out like a sore thumb. So I'll tell you one of the examples I saw up there, which is heat pumps. So we had a big, there's a big issue up in Canada on fire. And so all of us who are making some changes to our houses, one thing, and it was insurance related, is that we're all being told we cannot have wood stoves. And I hear this is going on in Colorado and stuff. So there are these things that we don't want mandated. And, you know, everybody loves their fireplace and everything, but when you really look at the cost of having that fireplace as far as to the general well-being, you start to feel the pressure to not have the fireplace. And doesn't have anything to do with over hours, but I did notice, I mean, the number of houses that have ramps, the number of when you're redesigning, the number of questions coming from the architects saying, do you do this? I mean, it was simple. For instance, I put in a new bathroom. I asked it that new bathroom all have bars in it so that someone could use it and have a no entrance, so that someone could use it for you know, if they had some sort of a disability. I have an outdoor shower. When I put that outdoor shower in, the first thing I said is I want that outdoor shower to be all level so that it can be used by somebody easily. And so, those were recommended to me by my builder. So I think that's,
Well, that's a kind of, I mean, it brings up a really important point that Susan Orton and I have been working on this universal design ordinance for the county for a long time now. And what we keep contending with is this tension between, the public good of something and the desire for no mandates and allow people as much freedom to do what they want when they want it as possible. And so it led us to a different approach for this universal design ordinance, which was originally going to be a mandate that all new, some percentage of all new homes built in an unincorporated county would be required to do blah, blah, blah. And it evolved through discussions with the major trade organizations who would oppose that wording to something that becomes more of a consensus on an educational approach. And so it's the development of brochures that would be required to be, given to potential home buyers by the developer that say, here are specific universal design strategies that you can implement in your new home if you choose to, and here are the relative costs of those upgrades. And treating it as an upgrade package rather than a mandate was more palatable. It's still a challenge. It hasn't passed yet. And the wording is still, I think, probably being worked on by the attorneys. Susan Orton could probably fill us in if she knows of any updates on that ordinance.
No, apparently, I guess it was Linda talked with Lisa Clancy's aide, Craig, and they're still working on it. That's as far as it's gotten.
Yeah. So these things take a while.
That
Yeah.
is, in my opinion, that's under communication.
Yeah.
That's one of the things that the plan is going to address. You can do it on every item that communicate this effectively.
We're supportive of that because we just want something. We want it to be more, ultimately, the more homes that have accessible components in them, the easier it is for people to age in place. And
Dave, also, I think the other important thing is that buyers are not necessarily aware that these features are available to them. And by using this educational approach, they can see, hey, this is really, nice not to have, to have levered handles, or it's nice to have, a no step entry or whatever. And, the upgrades that they might be willing to pay for, maybe they're not thinking universal design or aging in place, but they really like the features themselves, or the walk-in showers. I mean, you can go online now and all the showers are either curbless or walk-in. That's the thing. So, I mean, it's really getting a lot more attention.
Yeah, and I think when people see that some of the items are not terribly costly, to move your electrical outlet 18 inches off the floor rather than 8 inches off the floor means that somebody in a wheelchair can now plug something in. It's no difference in cost by doing that. And the availability of lever handles for faucets and for doors, much greater choice now in the market for these things. It might be a slight upgrade, but it's not very expensive. And if you have arthritis, you know how hard it is to twist a knob rather than just push the lever open to open a door. Very simple things. There are some strategies that are very costly, but even those, some people who want to build their house and are really thinking towards the future and think, this is the only home I'm ever going to build. And I'm going to be 80 years old and I want to live in this house. I need to think about accessible entries from my garage into the kitchen. That's a very costly thing to do, but it's better to do it when you build a house than it is to come back 40, 30 years later and decide to do it. So we're hoping that this will get some traction, but it's been in the works for a long time. St. Louis County Home Improvement Program, research funding and workforce development update. I don't have any updates on that, although I do have, there's continuing update on the home repair network, which we're now participating in, which is the regional clearinghouse for all things home repair. And I encourage, towards the same discussion we had earlier about, multidisciplinary task force. I think it's important for people who might not be specifically doing home improvements or repairs to think about the home repair network as a venue to get to your people, and to participate in that organization might be worthwhile. But it's that organization, and I don't mean this with any irony, really benefited from the tornado, because it was in the news every single day, and the funders of the home repair network, large, very, well-endowed foundations, wrote some really big checks right after the foundation to support the home repair network, because there was an immediate need. And what people realize when you go in a crisis is that, hey, wait a minute, this problem is larger than what I really ever envisioned. And so, home repairs, we've discussed many times, touches so many aspects of public policy that we've talked about over and over and over again. Anything that you can do to keep somebody in their home as they age is seen as a net positive. People do not want to leave their homes. You poll older adults and you ask them what their priority is. In the top 5, and probably in the top 3, sometimes the most important thing is, I want to live in my home. I want to continue to live in my home. Anything we can do to help them stay in their home helps them have more autonomy over their lives. It's really quality of life. It's really important to productive aging, which, as we know. The other thing it does that is beyond older adult issues is that if you can repair a home, oftentimes in the city, we've seen this over and over again. If you cannot repair a home because somebody can't afford to do minor repairs or pay their taxes, they leave, they abandon the home. When a home is abandoned, that doesn't just impact that one home, it impacts the entire street. And so, it's this broken tooth concept. If you smile and see a broken tooth, you're less likely to, think positively about that individual. If you can save that home, you've saved a tooth. And it has a positive kind of effect on the whole neighborhood, because then you save one house, you can save another house, you save a whole community. you don't have this decline in communities. And there are other aspects of it, and a lot of it has to do with, spending $1 on prevention
Cost effective.
is much more effective than spending $1 on repair. Or on new construction, or on, whatever the consequences are of not fixing something. So, at our last meeting in June, one of our last meetings, we invited, Robin Harvey from Legal Services of Eastern Missouri to tell us how they can intervene early on and help people with the transition of their home to their children. And if you can just have that paperwork, as Sue knows, you can then apply for the repairs. Their money's available, but if you don't have the documentation that shows that you own the home, you can't do that. So these are all issues that are being dealt with by the Home Repair Network right now, and I see it as extremely impactful. Any new updates on Elder Financial Protection Coalition or Missouri's broadband initiative?
No.
Okay. Property tax relief for older adults, circuit breaker legislation. We found out this summer that it was passed by the state. It was tied to some other things that we might not want, but it was able to be passed. And there was I don't know how many people attended the was a Missouri Budget Office's presentation at the Heights in Richmond Heights a few months ago. That was presented to us. So that's a good thing that that's something that people on this commission have been fighting for a long time. So chalk one up for success. I think Carol Rodriguez sent out an mass email when that passed. Corp and Aging Ahead updates. Anything that you think we need to hear?
We are Cory is trying to get back up to some of the programs that we used to have. So hopefully we'll have an actual update soon. That we're trying to get some more legal resources in and get things a little bit more like they used to be.
Okay. From Aging Ahead's perspective.
We're really just watching what's happening with the federal budget. We are anticipating that Older American Act funding will be flat, which is relatively good. No cuts, but other things that are looked at being eliminated would have an impact on people needing services. So just watching what's happening at the level, and I'm trying to keep up with the advocacy around that.
Okay. And I know Nicole is not on the call and Jamie's not on the calls, and we've already talked about the senior fund in the county, so there are no updates unless somebody here knows something in the city. Commission on Disabilities, Sue Orton, anything happening in your? Commission?
Yeah, we actually had a meeting before this meeting, so I have a report. We had a member of the police academy come because we were discussing the idea of the number of handicapped parking spaces that people take them and they really don't, what's the penalty for it? How we can get more information out to the community on, you don't park there. He really did not give us a lot of information about how much of a penalty there is. But we also talked about the idea of, because he said he was from the police academy. He said they do have an educational component for their new officers. So one of the things we suggested was maybe perhaps doing a PSA. We also talked about other kinds of educational information that maybe we could come and give a little workshop or something like that to the policemen, so that we would be able to inform them that, yeah, you really got to monitor this and really, come down hard on this. Because she said no movement on the universal design. The other thing that we did, and we've been talking about this, is the transportational vehicles for people in wheelchairs. Metro versus Lyft or Via. And so that's definitely something that we're going to be working on, is a transportation upgrade on that. That's it.
Thank you, Sue. I do have something to share in the additional comments or the commission member share out. So as you know, I've been participating in the STLCO 2050 Comprehensive Plan. And I'm just going to read a notice that I received yesterday from the Deputy Director, Department of Planning, Mel Wilson. It is with immense professional joy that I can share that the St. Louis County 2050 an equitable and sustainable comprehensive plan was finally passed as the county's general plan at the September 2nd, 2025 council meeting, with Dr. Page signing the bill into ordinance on September 3rd, 2025. Your time, effort, and contribution to this plan were instrumental in creating the ambitious vision of STLCO 2050. And on behalf of Director Jacob Trimble and the entire planning department, you have our immense gratitude. We are moving straight into plan implementation, starting with the facilitation of the Spanish Lake Small Area Study in Council District 4. So let's make sure Cookie is aware of that one, because that's been in the works for a long time. I look forward to partnering with the members of the committee in new ways over the next several years as we move the recommendations of the STLCO 2050 into concrete results. Now, if you Google STLCO 2050, you will come up with this enormous comprehensive plan, but you can navigate it if you're interested in affordable housing, or if you're interested in accessibility, if you're interested in something like job growth, you can go in that document and see what has been recommended and is now an ordinance. So over the next 10 years, we're going to see implementation of this. A lot of work. I feel really gratified that we were able to get a lot of priorities on older adult issues into the plan. A lot of it had to do with accessibility and housing affordability and availability.
Transportation and roads.
We did a lot of discussion about transportation. A lot of it had to do with creating walkable neighborhoods, encouraging mixed use developments along walkable paths in the central area of communities, which will then help support better public transportation along those links. We did talk about more grand ideas. I'm not sure they're going to get implemented unless there's money, like expanding a bus route out, parallel with Manchester all the way out into Baldwin. There are things that, because, everybody acknowledges that there are severe traffic problems and that there would be public transportation solutions, but they're extremely costly. Because, ideally it would be a separate lane for a bus.
Electric buses.
Yeah, but these are grand ideas. They were mentioned in the plan. I can't say that they're going to be the top priorities though. But they were discussed, as well as other rideshare systems and things like that we've talked about are in the plan. So we did our best. Any other share outs?
I just wanted to mention one other item. When we were going over this, we met at this meeting down in Lee and what have you on the plan for the state 10 years. I just posed the question of employer participation. And I know we got legal issues and all that, but it seems to be somewhere in there where employers could contribute more if they knew about it or they cared about it, and they could do it free of charge or something like that. When you go in and you fix somebody's plumbing or whatever, they see a problem. But they somehow help with that situation without breaking the bank for the homeowner or something like that. So anyway, there's better relations with employers might be something that we could. It always seems like the employers can't do it, it's too costly. And maybe there's some avenues in between there.
I mean, it's a good thought because, we know that there are services available and there are problems on both sides. There's how do the people know that those services are available and how can they conveniently avail themselves of those services? Like some sort of resource guide would be helpful, or some easily navigable website. You can click a button and go, I need my air conditioning fixed and I need support for that. So, there's that end from the user side, and then there's the provider side. How do you get the information out?
Yeah.
But and then, as you're suggesting, there are other avenues to make people aware of it, but how do you do it without being invasive? Or hurting somebody's, feeling that you're treading on their turf somehow? How do you do that?
And this is 10 years.
Yeah,
We gotta be able to make some progress in that area. Anyway,
so, any additional comments? We're not gonna vote. Any advice on how we can communicate when our meetings are and whether they are virtual or in person better than we are doing? I think, Heidi, you and I just need to go through every email address that we've got in there to make sure people are getting it.
Yes.
But I mean, the fact that we've had improvements on actually being able to get the room at a time, so we've learned, tomorrow, we're gonna set the.
Today.
Today. The next meeting will be virtual, October second.
I'm sorry, Susan suggested to book you the rest of the year,
They broke them out.
but they said you couldn't do it.
You could not do it?
Right. I don't know if that's true or not, but that's what they
did.
said.
I booked it like in December for January through June,
All right.
and then in June,
If there's-
the rest of the year.
We'll ask about that some more.
There's no
They changed
opposition.
the policy.
Right.
Virtual only next month.
It's virtual only next month,
That would be on
the 2nd of October, first Thursday of the month. And I'm sorry we didn't have this one on the first Thursday, but I was out of town and I really wanted to be here for this. So,
can we make any evaluation on our meetings, whether they're online or whether they're in person, as to the value and the benefits of it? I mean,
do you want to say, okay, so what do you mean by that?
it seems to me like if we do things in person, we're getting more input, and I don't know. There are factors where it should be
Yeah.
online, but maybe we should encourage in person. Just seems,
Well, there's a tension between people like me who have a hard time devoting 2 hours a month to showing up, plus travel time in person when I can do it from my desk. And so I'm probably one of the culprits in going to, some virtual. My opposition has always been towards the hybrid meetings like we're having today. When it's 100% virtual, it's my impression that we get good participation because we can see everybody, they can see us, there are no disruptions from somebody sitting in a room, somewhere that you can't hear. We generally have had good participation when it's all virtual. We've always had good participation when it's all in person. We've had spotty participation when it's hybrid. You might just, and fight me back on this if you disagree.
I can say, sort of one of the things that, as I think maybe what we can try to do is like, for instance, this was in person and because of September and schedules, we haven't got enough people here. If we do October, all virtual, let's do November, get everybody together, because I think one of the things that's important is we need to know each other.
Yeah.
And now we've got new members. I know with Cookie, one of the thoughts that came, I was gonna contact Carol, is she needs a ride. So these are all things that we as a commission can help one another with. But I do think the personal, back and forth between us is helpful.
Okay, so let's work on increasing the frequency of the in-person, but let's not eliminate the opportunity for virtual. So let's try it where we're alternating. Let's see how that goes. I'm for that.
very well, it would be a better way to do it.
Okay, so if you want
So you're
to,
saying we want to have all virtual and all in person?
well, whenever we have an in-person one, we have to have,
Oh,
we're
okay.
required to have, a virtual component.
Okay.
But if we encourage people to show up, then the virtual component is less important. Well, if there are no other comments,
Well, will we know about all the new members and all that? Will that be?
Well, it's gonna be in the meeting minutes.
Okay.
And then we will hopefully have an opportunity to thank the people that have rotated off the commission, because I think we haven't, it happened rather abruptly and over the summer. You know, it would be great to be able to say thank you to Wilma and to Lisa for their long years of service somehow. So let's talk about that.
There was some talk about Lisa staying on the commission as a volunteer, is that?
We'll have to reach out to her. I don't have an email. The only email address I had for Lisa was her one that's no longer working. Yeah.
Reach out to her, and she did express an interest in staying on the commission just because she has so much knowledge and so much.
Well, she can attend.
Yeah,
She can always attend.
she's an attending but non-voting participant.
Anyone can attend.
Yeah, but we are required to have people from specific agencies or universities, and so we want to make sure we fulfill that. Hello, Lillian, I'm so sorry for your loss, and thank you for joining us. Okay, I don't know, but we are wrapping up, and so if you could try to acquire this room, I mean, I think it worked, I think people
Okay,
figured,
yeah,
for
for November.
November and then January, just alternate months.
January?
No, if we're gonna go
Every other
October,
month.
every other month is gonna be in person.
Once we get into winter weather time, there may be less people able to do the in-person.
Well, we can talk about, we can
Yeah.
revisit it in November.
Yeah.
But let's definitely do November face to face.
The way the weather's going these days, we're probably gonna be snowed in April and
Yeah.
it'll be sunny in January.
Yeah, right. Air conditioning on.
Hello, everyone.
It's necessarily commission business when you talk to you. So the other challenge I had this time was apparently our new legal services representative person has taken another job. So, I mean, still within the county, but I was chasing down like anybody I could find to get the legal proficiency thing signed off on.
Oh.
And so how do I know who's going to be the next person? There has to be a person that's assigned to the commission?
Would you have the Jen?
Oh, I thought she retired.
Like she didn't.
Okay, so that's a challenge. It's been my position.
I thought she retired.
We had the difficulty that we had last year, and we had so many meetings that we had to cancel or have not a quorum for, that I just got fed up with it. And I'm saying, I don't care about, I mean, I do care that we were above board and that we are open, but we, as a commission, are doing everything we are doing correctly, and somehow things are not getting done on the county side that we cannot control, and I'm not gonna allow that to prevent us from meeting anymore.
So talk to Matt Callahan.
Well, the person I
He
finally,
is not part of, he used to be our representative.
Right.
And then.
I think I met him once.
But well, he's inside that department,
okay.
so he might be able to tell you.
I think, I actually just like looked in the county website and found someone who's like an office manager and emailed them. I figured they know what's going
Yeah.
on. And she actually did help me and she found some supervisor, somebody that at least this time did it, the legal sufficiency. But I don't want to have to do that every time.
But if they're in flux over there, then.
Do you know, is John Rothbard still alive?
As far as I know, he's still,
We don't know.
moved to like Michigan.
Oh, did he?
Yeah. Or I don't know where I don't know why I think Michigan, maybe, he moved. He actually, I think,
The talk about.
he has relatives somewhere.
Yeah.
I think that's where he moved with near, to be near my daughters, and I want to say he almost had a place there anyway. So,
Because he was not a young man.
no, he
He
was.
was doing stuff. Yeah.
No. And that in defense of not having a resource guy, Dan, that is a monumental job, and no one else would take that on, because Lutheran Senior Services did it before John Rothbard took it over. And it got to be too much for them. Leanne worked on that.
Yeah, yeah. But they were Well, yeah, that got strange toward the end, because there was a competing outfit out in Cincinnati. And
Oh, yeah, well, when they went to that, that's what shut
Yeah.
it down. So, and-
Hello,
We
everyone.
can only control what we can control.
Right, exactly.
And I've said this in, broadcast emails, that we've got important things to talk about and work on, and we can't be hampered by some,
damn legality.
yeah.
All the hoops and steps that have to be.
I mean, the key is that we always have a virtual invitation a week ahead of time, is that correct?
Yes, I'm gonna start seriously setting it like today and tomorrow.
That's
So we
fine.
don't have that problem anymore, because apparently they only have 2 per day or something, 2 licenses per day to do a WebEx.
Absolutely ridiculous.
So, yeah, somebody with WebEx, that you only have 2 for any given day or something.
Yeah,
So you get them down, right, they wouldn't let me. But
yeah, the purpose of the,
like today.
the purpose of a sunshine law is not to prevent meetings from happening.
Right, right.
Sir?
Are you guys done? And there's somebody that was trying to speak with you.
I'm sorry, Lillian, thank you for joining us. I'm sorry that we weren't able to participate early on.
Not a problem. I'm so glad that, let's see, I am so glad that I was able to join you all. And so, just thank you I had to get to that funeral. And so with that, that's the only reason why I'm not there, because I agree with you. We need to meet in person. We've got important work to do, because somehow older adults are being forgotten. It's like, what is going on?
Yeah.
Mhm.
Yes, well,
Okay.
thank you. Next month, we'll vote on the meeting minutes because we didn't have a quorum today. But it's, I
Okay.
had, I apologize for having to change the date of the meeting this month, but.
Not a problem.
Schedule next month.
Okay, that sounds
Virtual
great.
Meeting next month. Thank you.
Take care. Bye-bye. Thanks.
Okay.